আজকে আমাদের পজিটিভ সাইড স্টুডিওতে আমাদের মাঝে উপস্থিত আছেন ডক্টর মঞ্জুনাথ। উনি ভারতের বেঙ্গালুরুর বিখ্যাত বেবি সায়েন্স আইভিএফ ক্লিনিকে একজন মেডিকেল ডাইরেক্টর হিসেবে আছেন। উনি দীর্ঘ 16 বছর যাবত ইনফার্টিলিটি জনিত রোগের দেশ এবং বিদেশে চিকিৎসা দিয়ে খ্যাতি অর্জন করেছেন। We just ask you some question which is normally some patient ask us. If we explain the questions, it will helpful for our patient. Our first question is, when we suggest IVF for a couple?
Normally, IVF is not suggested for every infertile couple. Usually, when they come for evaluation, we check that whether the tubes are blocked, or the egg reserve is less, or any sperm factors are low, the count or motility are low. And if they have tried natural try, and if they have tried IUIs, everything, in spite of that, if they fail, then we suggest them for a IVF. So sometimes we directly suggest to go for an IVF in cases of both the tubes are blocked. If the age is more than 37, 38 and egg reserve is coming down, or if the severe male factors, Asospermia, are very low count, in such cases we directly tell them to go for an IVF. Otherwise, usually we ask them to try with the ovulation induction drugs, then 3 to 4 cycles of IUI. If they don't conceive in that, then we will suggest them for IVF.
Next question is, can Asospermia patients do IVF with his own sperm?
Asospermic patients, if they come to us, what we will do is, generally we first do them, try to give some kind of hormone injections and try to improve the sperm quality within the testis. Then we go and do a testicular biopsy called as TISA-PISA. So using that procedure called TISA-PISA, we extract the sperms and use the same sperms for doing a procedure called ICSA. Through that, at least 50% of the people can conceive and they can have their own children. Means they can father their own children. Go for a donor sperms. So Asospermic patients need not lose hope. They have a hope and they can become their own father of their own child by doing procedure called ICSI with TISA-PISA. Sometimes it requires micro-TISA. All those procedures are like within the testis, we will extract the sperms by using a small needle and use the sperms for doing a ICSI procedure.
It is an appreciable answer. Thank you again. Let's go to the another question. If the female patient have both fallopian tube block, what would be the treatment?
Both fallopian tube block usually happens due to some kind of infections. So when we do, in such cases, we do a laparoscopy initially. And if it is a minor block, we try to remove that block by doing a hysteroscopic cannulation and laparoscopy. If it is a minor block, we can remove that block. And then they can try either natural or IUI procedure. But if it is a major block, we cannot remove using either hysteroscopy or laparoscopy. In such cases, we need to advise the couple to go for an IVF procedure only. In IVF procedure, they have a good success rate. When means that only the tube will be having a problem. Usually the sperm and the egg will not have any problem. So they have a highest success rate. Such couples have a highest success rate if they go for an IVF procedure.
What is treatment of septic uterus?
Septic uterus, which is one of the commonest abnormality in uterus, like uterine anomalies we call. So in that, septic uterus is the commonest one. So what happens in septic uterus, there will be a division between the uterus. The uterus cavity will not be a single. It will be divided into two halves. So in such cases, there will be increased chances of miscarriages or increased chances of abortions, all those kind of things. So for such patients, we do hysteroscopy and laparoscopy. And through hysteroscopy, we can cut that septate uterus. So when there are two halves, we will make that as a single uterine cavity. So when we make it a single uterus, so the chances of fertility will improve and chances of miscarriage will come down. So this is the treatment for septate uterus. we do hysteroscopic septal resection. We call that term surgery as hysteroscopic septal resection. It is almost 80% 90% cured kind of treatment.
I won't take more of your time. I just want to ask you one more question. The question is, if normal conceive possible with low AMH?
Low AMH is basically predicts how much egg quantity is there in the ovary. So it's an indirect test to know how much egg reserve is there in the ovaries. So nowadays we are facing lot of problem with a low AMH. So once the female crosses the age of 32 to 35 years, the AMH will start falling. So then conceiving becomes very difficult. If the AMH is somewhere between 1 to 2, still they can conceive naturally, but they should not take too much time. Maybe 2-3 months they should try. If they don't conceive, they should move ahead with an IUI or an IVF. But if the AMH is less than 1, they should really go and try an IVF, which will give them a good results instead of wasting time. Whenever the AMH falls, there is no much time for them, because every month the AMH will start coming down. The lady's egg reserve will come down. So we should not waste too much time. They should try the procedure which will give them a good result. That's an IVF procedure.
Thank you again and again. Thank you so much, sir, for your time and consideration and your answers.
Thank you so much.
আপনাদের সকলকেও অনেক অনেক ধন্যবাদ আমাদের সঙ্গে থাকার জন্য।